Malaria, a disease that has plagued humanity for centuries, continues to be a significant global health concern, causing millions of infections and hundreds of thousands of deaths annually. What makes malaria particularly dangerous is its ability to mask itself, camouflaging its symptoms with those of common ailments, making it difficult to diagnose in the early stages. Malaria, often referred to as the silent assassin. In this video, we will delve into the world of malaria symptoms, revealing how you can easily know that person have this ancient disease. In its initial stages, malaria might resemble a regular flu, luring its victims into a false sense of being healthy. Note that all of these symptoms does not occur in an individual, rather a few of them manifest. Make sure you watch this video to the end because knowing these symptoms is a very important life-saving skill. 1. Fever, the universal red flag. The most common and recognizable symptom of malaria is an abrupt onset of high fever. This fever can be accompanied by chills, profuse sweating, and headache. This fever is the body's reaction to the parasite invading red blood cells and releasing toxins, a process that repeats in cycles. However, the fever in malaria comes in cycles, occurring every 48 to 72 hours, a unique pattern that sets it apart from the common cold or flu. 2. The creeping weakness, fatigue and weakness. Malaria doesn't stop at fever, it extends its reach to induce overwhelming fatigue and weakness in its victims. As the parasite multiplies within the red blood cells, it weakens the host, leading to fatigue and exhaustion. Imagine feeling perpetually drained, your energy reserves sapped by an unseen enemy. This insidious weakness gradually envelops the body, affecting daily activities and leaving the person incapacitated. Another reason for the weakness is that malaria parasites feed on red blood cells, leading to a decrease in hemoglobin levels, resulting in anemia. The gradual reduction in red blood cells causes extreme fatigue and weakness. You can contact us via the link in the description below for any medical inquiry. 3. Nausea, vomiting and loss of appetite. Malaria can also trigger nausea and vomiting, which can further weaken the affected individual and lead to dehydration. These symptoms often exacerbate the vicious cycle of the disease. Don't forget to like and subscribe to our channel. 4. Muscle and joint pain. Malaria can cause severe muscle and joint pain, leading to considerable discomfort and limiting the mobility of the infected person. The pain is often described as bone deep and can persist even after the fever subsides. 5. Headaches. Intense headaches accompany the fever, adding to the misery of the afflicted. These headaches, often described as pulsating and throbbing, can be incapacitating. The pain feels as if the very essence of one's being is being crushed under the weight of the disease, rendering even the strongest souls helpless against its onslaught. 6. The silent attack on the organs. Malaria doesn't stop at mere flu-like symptoms, it infiltrates the vital organs, wreaking havoc on the body. Headaches, nausea, and vomiting are common as the parasites disrupt the normal functioning of the brain. Severe cases can lead to confusion, seizures, or even coma, highlighting the gravity of the disease. 7. Jaundice and dark urine. One of the hallmark symptoms of malaria is jaundice, a yellowing of the skin and eyes caused by liver dysfunction. This occurs when the parasites infiltrate the liver cells, impairing their ability to filter waste products from the bloodstream. Dark urine and pale stools often accompany jaundice, painting a vivid picture of the massive destruction of red blood cells. 8. Anemia. Left untreated, malaria can take a deadly turn, leading to severe complications such as anemia due to the destruction of red blood cells, acute respiratory distress, and organ failure. Pregnant women and young children are especially vulnerable, their weakened immune systems unable to fend off the relentless assault. Please subscribe to our channel for health tips. 9. Enlarged spleen and liver. An enlarged spleen and liver are common complications of malaria. The enlargement of these organs can sometimes lead to severe abdominal pain, posing yet another challenge to the infected individual. 10. Severe malaria, a lethal variant. In some cases, malaria can escalate into severe malaria, a life-threatening condition characterized by the impairment of vital organs such as the brain, kidneys, and lungs. Severe malaria can lead to coma, respiratory distress, kidney failure, and, ultimately, death if not promptly treated. 11. Cognitive impairment, the malaria brain fog. Some cases of malaria, particularly those caused by Plasmodium falciparum, can lead to cognitive impairment, confusion, and even seizures. These neurological symptoms are a frightening aspect of the disease, illustrating how malaria can affect not only the body but also the mind. 12. Disturbed sleep. Malaria is notorious for disrupting sleep patterns. Nightmares, night sweats, and a general sense of restlessness haunt the infected, robbing them of the solace that sleep brings. For the affected patients, the nights stretch endlessly because they are unable to sleep well. Our next video will be on how you can get the new malaria vaccine. Kindly subscribe to our channel so that you can be notified when the video is out. Note that knowledge is advancing by the day and we will like to always post an update on new advances on how to stay healthy. Please subscribe to our channel. You can contact us via the link in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Kayode.